And joining us now is senior scholar at the Johns Hopkins Center for Health Security and Infectious Disease, physician Dr. Amesh Adalja. Doc, you know, a lot of us are not loving the news of this for many reasons, but it harkens back to the tyrannical days of COVID, and we're like, we don't want to do this show in boxes again. But, you know, the CDC or others in the field have repeatedly said, hey, this is not like COVID, this is not like coronavirus, don't freak out. What do we need to know at this point, and what should Americans brace themselves for as these passengers come off the ship, as they go to Nebraska, and they have the choice whether to go home or not?
The first thing is to recognize that different pathogens, COVID, hantavirus, influenza, measles, whatever it might be, they all have different transmission characteristics. So even though any of them can cause a public health emergency, there's a different caliber to them. So when you're talking about the Andes version of hantavirus, yes, it can spread from person to person, but it's really constrained in doing so. So it doesn't pose an epidemic or a pandemic threat. Only certain things can actually cause a pandemic, namely respiratory viruses. And I think that this plan of bringing these passengers home, checking them in Nebraska, and then letting them do home quarantine with follow-up with local and state health department officials, that's a legitimate and rational way to go about it. And we did this for Ebola doctors that had come back to the United States after the outbreak in 2014, and that went off really well, even though that's even a more high consequence disease. So this isn't something that the general public needs to worry about. Things are happening the way they should, and the virus is behaving exactly as we would predict it to behave.
Doctor, I appreciate you saying that. Sounds like there's a veil of common sense getting thrown over a lot of fear, but that fear is warranted. I mean, we did go through 2020, and, you know, for 100 years almost, we hadn't seen anything like that until then. You know, looking for something positive on the back end of COVID, have we, you know, are there advancements and techniques and things that we've learned through COVID that help in these situations?
I definitely think they've learned a lot about communication and being nuanced and being able to deal with uncertainty. The WHO, I think, has handled this very well. We obviously, science has progressed. We know how to use PCR tests more easily. We know how to develop vaccines quickly if necessary. So there has been scientific advancements, but I think we're also in this era where when there is any kind of infectious disease emergency, everything is looked at through the lens of COVID, and not everything is COVID, and all of that gets bundled together. So people think that anytime anybody's concerned about an infectious disease, that means you're going to the bad old days of COVID, and that's kind of a false alternative.
Doctor, I think part of the reason why people might be concerned, it's not just the COVID thing. Yes, this disease is far less transmissible than COVID, but it is much, much, much deadlier than COVID if you do, in fact, contract it. So people might be worried about that for obvious reasons. We did hear in the clip that we played from Dr. Bhattacharya talking about previous outbreaks and the containment protocols working well with this disease. I wonder if you can address both of those points.
So the Andes virus is one that transmits from person to person, and there had been an outbreak in Argentina that was stopped once they kind of removed the infected individuals and used social distancing in that specific outbreak. That's not something that I think will happen at a large scale because this doesn't transmit through a population. This was a birthday party that got infected in Argentina. The other thing is back several years ago, someone with Andes virus appeared in the United States in Delaware, and they diagnosed that person in Delaware, and they did contact tracing, looked at all of our contacts, and no secondary infections occurred. So we know how to handle this virus. I think it's just important that public health authorities are resourced enough to be able to do it, but I don't think that this poses a risk to spread in the general population. Even though it's a deadly virus, it is really, really limited in its ability to infect people.
All right, Doctor, thank you for that. I have a question about just the way the CDC has been communicating. The leader of the WHO went physically on the ground, gave a lot of information, thanked the general population. We're seeing these, you know, a little bit dramatic video of people, you know, dressed in the suits, getting people off. For the French prime minister gave actual numbers that there were 5 French citizens that arrived on Sunday, that one of them developed symptoms during the flight. Very specific stuff. But when we reach out to our own CDC, even the State Department, we're not getting a whole lot of specifics. It doesn't seem like this would violate HIPAA or anything, and yet there's a lot of concern. Should we be getting more information from the CDC?
Definitely. I do think the CDC should be taking a proactive stance. They should have been doing it earlier on. It's good that they sent CDC officials to the Canary Islands, and it's good that we're hearing from the CDC, but what you want is communication constantly, even if this doesn't pose a threat. The CDC was the best public health agency in the world. So you want their experts to be engaged, you want them talking to the general public, and you want them to be proactively doing this. And the WHO, I think, has done a really great job just to try and calm fears because of all of this, the way that people are looking at this. That's why you saw the WHO Director General on the ground there. That's why you see the French president speaking in specifics, because they're trying to calm the public and do this the right way. And I think the CDC could add to that if their experts are allowed to engage with the public the way they have during other public health emergencies.
Doc, I have just two quick clarifying questions for you because I know our audience is really locked in on this. First, how does this spread? If you could answer that for us, because we know that there are other passengers that are showing symptoms, so it's spreadable. That's what we want to know. Two, when we hear about this French passenger that developed the symptoms on the flight, how long does it take for symptoms to show? Because we got these folks going to Nebraska. Maybe they don't think that they're infected, but maybe they go home wherever they live and they are. So could you just clarify those two things for our audience?
So hantaviruses in general are rodent to human, but the Andes version can go human to human. And it's usually people who have close contact with each other, people who share beds, who share utensils, who have exposure to each other's body fluids, like saliva, for example. So that's how it spreads. It doesn't spread the way measles does, or COVID, or influenza. The other thing is that the incubation period is long. It could be up to 6 weeks. So people can get sick anytime during that 6-week period. That's why we have monitoring for these individuals. And this French person that was evacuated, we expect to see cases amongst those passengers. It's not run its course. So there will probably be more people who were evacuated off that ship that are going to test positive, but they're going to be isolated and they're going to be treated appropriately in their contacts traced if they have any new contacts. That's the whole point of this whole process. But you shouldn't be alarmed if any of those passengers test positive. That's why we're going through this, to catch them as soon as they test positive.
All right, Dr. Amesh Adalja, thank you so much for joining us tonight, answering all our questions.
Thanks.